Newsfeed Now. Coronavirus facts, not fear, begins now.
Good morning and thanks for joining us here on this special edition of Newsfeed Now. I am your host, Ashley King. The situation surrounding COVID-19 in America continues to change day by day, hour by hour. We want to be there to help you understand where we as Americans go from here. Our goal today, as every day, is to focus on the facts. So let's get started with the numbers, the latest here from the CDC. There are at least 70,000 cases of COVID-19 reported in the United States. The death toll continues to rise each day. We are now at over 1,000 deaths reported so far. New York, New Jersey, and California continue to be some of the hardest hit states. Amazon now reports that an employee at its Staten Island fulfillment center has tested positive for COVID-19. The last day that person was at work was March 11th. Other positive cases have been reported at Amazon facilities in California, Florida, Kentucky, Michigan, Oklahoma, Texas, and Connecticut. Amazon has temporarily closed some sites, but has largely refrained from many closures. And breaking news this morning, a record number of Americans filed for their first week of unemployment benefits last week as businesses shut down to slow the spread of the coronavirus. The Department of Labor says initial jobless claims soared to nearly 3.3 million. That is the highest number of initial jobless claims in history since the Department of Labor started tracking that data in 1967. The previous high was 695,000 claims filed in the week ending October 2nd, 1982. And in the nation's capital bipartisanship, just before midnight in Washington, D.C., the Senate approves one of the largest emergency aid packages in the nation's history. The American people have 2 trillion reasons to feel a little more comfortable about the economy. That's the amount of the stimulus package the Senate passed Wednesday night. It includes $250 billion for direct payments to individuals and families, another $250 billion in unemployment insurance benefits, and $350 billion for small business loans, and $500 billion in loans for distressed corporations.
The Senate has pivoted from one of the most contentious partisan periods in the nation's history to passing this rescue package.
It now goes to the House of Representatives for a vote, which will most likely happen on Friday. Let's now bring in Jesse Turner from Washington, D.C. There are a lot of questions about this stimulus package, especially with the direct payments for people. So a lot of people we've been talking to here in the newsroom and calling in, they've been wanting to know, will this money be taxed now, or will you have to file it on your income taxes in 2020?
So I've actually been digging into that this morning. I just got off of a Skype call, since that's how we've all been operating lately, with a tax expert here in Washington. And she was saying that you won't have to, that this money won't be taxable. It's essentially a tax credit. And so it's literally just cash to the American people that really about roughly more than 80% of Americans should get. The amount depends upon your tax return, how much you make. But yeah, for the most part, Americans will at least individually be getting $1,200.
Okay. And you said since it does go off of your tax return, that 2018 tax return, what happens if you were, let's say, a minor and you didn't file taxes in 2018 and now you are an adult and you've lost your job? What happens then?
Yeah, so it sounds like that they're pulling from 2018 or 2019, but since all of this hit and they are pushing back the deadline to file for 2019 as well. The tax expert that I spoke to said that you can actually do it for 2020 and they'll just give it back to you then. And so there is a little bit of wiggle room there for a case like you mentioned. Something though that I think people need to know is that when you think about children, you get $500 per child, but now in the language of that bill, it applies to what is considered a child under the child tax credit. And so that's actually only 16-year-olds and younger. And so those 17, 18 college students, parents would not be getting $500 for them.
Ah, that's good clarification there. What about, I know it's supposed to be deposited or direct deposited into your account. How are they going to figure out our account numbers and stuff like that?
Right, so that's why it's important that really the Treasury Department, what they're going to do is they're going to pour over these 2018 and 2019 records. And for people who have had that money, your returns deposited directly to your account, all you have to do is sit back and wait. And also, if you already had a check set up and you have the correct address in there, all you have to do then is sit back and wait too. And so you don't have to go online or call or anything like that. For the most part, they already have your information if you've filed your taxes. And so that's why the expert too was saying if you haven't filed yet for this year and didn't file last year, that's when you really need to file pretty much now to make sure you get that money, or else you would have to wait for 2020 if you're going to file then. We did hear from Secretary Mnuchin last night during that White House coronavirus task force briefing that they typically do every day, that this money would be going out within the next 3 weeks.
Okay, I was going to ask you that. So as far as the small business loans, can you elaborate about how that will actually work? I know there are a lot of small business owners out there looking for this.
Yeah, most definitely. And from what we've been hearing from small businesses, and it's not as easy getting the money as it is for direct payments, right? You actually have to go and ask for these loans. And that has been a problem recently with having to go online. People have been saying that it's been taking slow. It's been really glitchy. And so Mnuchin was able to address that last night too, saying that they're really trying to iron everything out now that this is pretty much looking like it's going to pass the House on Friday, and then the president will pretty much immediately sign it into law. He said that they are really going to try to work out some of these glitches over the weekend, and so then hopefully by next week, small businesses can really start feeling the impacts of that money.
Okay, and then if you were, let's say you were disabled on Social Security and you didn't file taxes, how will that work? Will you still get a check?
So it sounds like you will, because the Treasury Department also has your information to send you those checks. And so there's a special form or two that they already have on file. And so even though people are on Social Security, disability, things of that nature, and don't file a tax return, because they also have their information online to send them that check, it also sounds like they'll be getting this check.
Okay, and I know you just had that interview, you said, with a tax expert there. Anything else, any important other takeaways that you got from that interview?
Really, it sounds like for the most part that people will just kind of have to sit back and wait. But for 2018, 2019, as long as you filed, you're essentially good. And then, it sounds like no matter what, you'll be getting the money. You just may have to wait until 2020 if you didn't file. But I think that note about the kids is really important, because I've been seeing a lot of that on Twitter. Just, does my 18-year-old qualify? Things of that nature. So I guess one of the main takeaways is just don't be disappointed by the amount of money if you thought you would get more, because there is language in the bill that just made the child 16 years old or less. I'm trying to think if there's anything else, but I think that that's the main takeaway. And she said too that it's kind of unprecedented in a way, just because this hasn't happened for more than a decade. But direct payments did go out during the recession of 2008 as well.
Okay, and real quickly, can you just kind of wrap up what happens next? It was passed in the Senate. Where does it go from here?
Yeah, sure. So it did unanimously pass in the Senate finally late last night, and now it essentially sits on the House floor for 24 hours so members can read it and know exactly what they're voting on. And then tomorrow, like you were saying, the House is expected to vote on it, but a lot of members won't be coming back for that because they want to stay in their districts to protect themselves from the coronavirus. And so that's why it'll probably be on a voice vote or recorded vote. And then, it should be going to the president from there. So that's why this weekend, really the ball will start rolling on all this.
Cool. All right. Well, thank you so much for giving us that update. I know a lot of good information there that a lot of people wanted to know.
Yeah, of course. Thanks for having me on.
All right. All right, moving on now. Elton John may have postponed part of his North American tour due to the coronavirus pandemic, but fans of the music legend can still see him perform on TV. Elton John will host an hour-long benefit special Sunday night to raise money for frontline healthcare workers and first responders. It's called Fox Presents the I Heart Living Room Concert for America. It will feature Alicia Keys, the Backstreet Boys, Billie Eilish, Billie Joe Armstrong, Mariah Carey, and Tim McGraw. And according to Fox, all the artists will appear from their homes, their own homes, and be filmed with their personal cell phones, camera, and audio equipment. Proceeds will go to Feeding America and First Responders Children's Foundation. Broadway's biggest night is being postponed because of the coronavirus pandemic. The 74th annual Tony Awards was scheduled to take place June 7th at New York's Radio City Music Hall. The show's production company said Wednesday that the health and safety of the Broadway community, artists, and fans was the utmost of importance. Producers say a new date will be announced once Broadway opens up again.
My fellow Californians, real important message. I need y'all to stay in the house for me, man. Real talk. I need everybody to stay in the house. I know it's hard, but we got to stay in the house so we can get this thing, under control. So please do me a favor and stay home and spread the word. Stay in the house. Do not go outside unless you have to. Please. The longer you stay outside, the longer we're going to be inside. I love y'all. This from Big Snoop Dogg.
All right, in California, Governor Gavin Newsom is releasing videos of celebrities urging people to stay home. Newsom issued a stay-at-home order last week. Both Snoop Dogg and Will Ferrell released videos this week. It's likely the measure will remain in place over the next 2 or 3 months. Healthcare workers are on the front lines of the COVID-19 pandemic as it continues. So what are emergency rooms and EMS workers doing to not only protect themselves but patients as well? Ed Gallick takes a closer look.
Spraying, mopping, wiping. Only the Fox 8 I-Team rolling here as Cleveland EMS trucks line up for deep cleaning. City ambulances now go through cleaning like this, sometimes daily. Never done before, but crews are doing it now to help slow the spread of the coronavirus.
I understand that you're requesting an ambulance because you had a fever and you were coughing?
Yes, that's correct.
Okay.
The I-Team has shown you local EMS crews getting a growing number of calls for people with symptoms of the coronavirus. The crews have always done some disinfecting and cleaning after every ambulance run, but now doing much more, trying to make sure rescue squads don't end up carrying the virus.
Because I don't have a mask on.
You want to make sure the extra steps are taken, especially in a time of an emergency like this.
The I-Team also found other cities in Northeast Ohio doing extra cleaning of EMS units, among them Parma, Cleveland Heights, and Sandusky. And if these trucks end up hauling a coronavirus patient to the hospital, the units get even more than a good scrubbing.
Sterilizing the ambulance as best they can, and then as a subsequent to that, if necessary, we have a local company that provides high concentration hydrogen peroxide and steams the ambulance out, and then we deep clean it again.
Here in Parma, the fire department has even made arrangements to give first responders an emergency place to stay, rooms to use in case they think they might have been exposed to the coronavirus, and they don't want to just rush right home to their families until they find out more.
So is this guy going to be in his house until then?
Rescuers deal with the danger, rushing to help you. Now they're going out of their way to protect you from the patient before you.
We are fully suited up and ready to go.
All right, we are bringing in Ed now from Cleveland. And Ed, I can only imagine what it's like to be a healthcare worker right now. In Ohio, have you guys actually heard of any healthcare workers testing positive for the coronavirus yet?
Well, we've actually had some first responders, firefighters, we've had some police officers, so this is really starting to affect everybody. And we've also seen a lot of new steps, as you just saw, the local first responders trying to take more steps themselves to protect themselves and also the patients that they're treating for everyday kind of illnesses and incidents.
Yeah, can you talk a little bit about the strain that may be putting on these first responders? They're now having to kind of think about things they didn't have to think about it before.
It really is the kind of thing where a new departmental notice just came out yesterday, as a matter of fact, late yesterday, for Cleveland EMS workers, telling them be prepared to potentially be exposed on every call. So when you think about that, this is a memo that came out and said if you test positive, these are the steps you should take, this is who you should go to see, this is when you can come back to work. And oh, by the way, just be prepared on every call you go on, you could be exposed. And when you think about that, that hits you pretty heavily.
Yeah, definitely. And speaking in terms of Ohio now, how are people responding to sheltering in place there?
You know, it's all over the board. We're getting avalanched with calls and emails from people saying, what about this place? What about that place? This place shouldn't be open. That place shouldn't be open. And it's not just us. checking with the local health departments, one nearby here told me this morning that it has had 344 complaints and calls. That's just one county south of Cleveland that has had that many complaints and phone calls from people saying, wait a minute, this place shouldn't be open. Why is that place open? So a lot of people are sticking to it. A lot of people aren't. A lot of people are saying, we don't really know where the line is.
Yeah. All right. Well, I see you're considered an essential employee. You're out in the car right now doing your job. So stay safe out there. And thanks so much for joining us this morning.
Absolutely. Thanks for having me.
All right. Turning now to Oklahoma. ER doctors are also on the front lines, many risking exposure to their own personal selves. So one doctor in Oklahoma City is sending a strong message to others and sharing her first count experience inside the emergency room. Here's Jolene Chansey.
It's a disrespect for humankind. It's, think about not only elderly people, we're seeing young people dying of this. We don't know who it's affecting. We don't know how this virus is mutated as it's made its way across the world.
Dr. Zagari isn't a medical expert somewhere else in the world or even across the country. She's an ER doctor right here in Oklahoma City at the only level 1 trauma hospital in the state. She lives here, she works here. She is a married mother of 2, ages 1 and 3.
I've been journaling to my children about what's going on in the world and in case something happens to me so that they can understand what I do for a living.
And what she does to save lives. And right now, that's on the front lines of the COVID-19 pandemic in Oklahoma.
I say it's very serious, not because of the numbers we're reporting, but because of the numbers we don't know about. We don't have enough tests out there to test everybody, so our numbers are deceivingly low. And that's very scary because we know this incubates for 2 weeks, so anyone who's infected can be without symptoms and touching surfaces for 2 weeks and spreading this. So it's terrifying.
Because when her shift is over in the middle of the night, she goes home to her family after being exposed to a virus that's brought the entire country and nearly world to a halt.
I'm worried that as a healthcare worker with my increased risk that I might not make it through this and they might not have a mother.
She's emailed the mayor, city council members, and the governor begging for a shutdown. Her request partially granted.
If you're feeling sick or you've been around someone who is sick, please stay home. Isolate yourself.
I think it should be everybody. I think you send one person to the grocery store once a week, get your needs, wipe everything down.
Right now, we know there are positive patients in that hospital, patients who are awaiting results and patients who are sent home because there simply aren't enough tests. And if they do have symptoms, they have to assume they have the coronavirus and isolate. And if Oklahomans don't stop going about business as usual,
people are going to die, and we're going to experience New York numbers here probably within the next week or two. It took China 2 months of being locked down just to stop seeing new cases. So at the rate we're going, this is going to go on for 3 to 6 months at a minimum.
Unless we make changes now.
It lives on surfaces for up to a week, and people shed the virus for up to 30 days, we're finding. So the whole point of closing schools and closing restaurants is that we don't go out and do these things, and people are continuing to do it.
All right, let's go ahead and bring in Jolene now from Oklahoma City. And Jolene, that doctor you spoke with there says that people are still not obeying orders to remain home. What message does she have for the community?
Basically, to take it more seriously than what we are. Her greatest fear, she is an ER physician, so she is basically on the front lines seeing this. They don't have enough beds for people who they anticipate will be sick. So what they're doing right now is they're kind of saving their test kits for people who are already hospitalized with symptoms and the staff, because if the staff is sick, that puts everyone at risk and makes the situation even worse. So when people show up at the hospital, they are telling them, just assume you have it and go home and quarantine yourself. So her biggest concern is people are not taking this seriously enough.
Well, and so as a doctor, what type of precautions, I guess, is she taking herself? Because, I heard she has children there. So what type of precautions is she taking?
She is holed up in her house and goes from point A to point B, which is from work to home to home to work. She works, I believe she said her shift at the hospital is from 4 in the afternoon until 2 in the morning. She says she works at her desk. She shares it with a couple of other doctors and nurses. So she is at her she's at her desk with gloves. She has a mask on. She does not eat at work. She's very, very cautious.
Yeah, wow. So as in general with Oklahoma, can you just talk a little bit about what the situation is like there regarding the coronavirus?
We have sanctions in place right now. All non-essential businesses are closed as of yesterday. But that's kind of the question right now. That's what a lot of people are questioning. What is essential and what is non-essential? Interesting point. Liquor stores are considered essential. Yes. And they are making deliveries. So a lot of restaurants are still open, but they're not open as far as dining in. So they are offering curbside services, delivery services. In Oklahoma City, parks are closed because if you remember from the story, Dr. Zagari said that this virus can live on surfaces for up to a week, and that includes playground equipment. So a lot of the parks are closed in the metro area. I'm parked at a park right now, and you would be surprised at the number of people, parents with small children, walking around. We're supposed to be practicing social distancing, and that's, stay at least 6 feet away from people. But there's a basketball court behind me, and children are playing basketball, and they're not 6 feet apart from each other. It's kind of hit and miss. What's essential, what's not? Can you expect people to stay inside their homes? Because clearly they're not doing it.
Yeah. All right. Well, thanks so much for joining us there from Oklahoma, and you stay safe out there as you continue to report.
Thank you so much.
All right. Over the weekend, we will be sitting down with doctors to get your key questions about the coronavirus answered. If you have a question, you can email it to coronaquestions@nexstar.tv. Your questions will be answered on live stream Saturday and Sunday. While stuck in self-quarantine, a Tennessee photographer was looking for a creative outlet. She decided to capture this unique moment in history with the help of her neighbors. Here's Brooke Reese.
I was like, what can I do to just brighten everybody's spirits?
Tasha Dickinson was looking for a creative outlet.
So I just posted on Facebook and said, with 5 hours notice, and was like, hey, I'm gonna walk around keeping totally safe distance, and I just want to take pictures of your family in this crazy time, so just do whatever you want.
And the photographer was surprised with how people responded.
Some people were very normal and just wanted to do just a normal family photo, and then some of my other neighbors got a little more creative.
Capturing snapshots from a time no one will forget.
I think what resonated with so many people with these images is that it did kind of show all different aspects of how people feel right now
as families experience COVID-19.
And they had their kids out there on their iPad, and he was drinking his whiskey because he's been working from home.
But also bringing into focus the uncertainty that comes with it.
Even though that photo was kind of funny, it's it still represents this people are scared.
All the while giving people a chance to smile.
This is just my easy way of just bringing some light in a dark time.
Reporting in Franklin, Brooke Reese.
I definitely love that there. Let's go ahead and bring in Josh now from Nashville. And Josh, this is an historic time that we are living through right now, but I love seeing stories like that, the community coming together. Can you talk a little bit about, or what have you noticed about the unity there in Tennessee?
I mean, it's amazing because you see stories like that where, people take something simple as just strolling around their neighborhood and taking pictures and making we've also had teachers throwing parades for their students because students are at home and they're bored and they're giving them something to do, so they drive by their homes and keep a safe distance. But they're doing stuff to just kind of entertain the kids, and we've seen a lot of community support here. There's a 6-year-old in our area who has cystic fibrosis and has been diagnosed with COVID-19. So the community's been coming together and throwing him parades as well right by his home. It's a great time, and especially stories like that kind of showing how people are coming together.
Yeah, I love that for sure. I know the numbers across the country continue to increase. What's the situation like there in Tennessee?
So right now the state is saying there's about 784 cases at last check as of yesterday afternoon, but a lot of numbers are lagging. They're not being totaled, just like you're seeing all across the country. So it's probably closer to about 1,000 now. We just got updates here from Nashville where they're saying about 300 people, including a 2-month-old child. So these numbers are just going to keep going up, and it's crazy to see. It's historic times.
Yeah, wow. Thank you so much for giving us that update there from Nashville.
We appreciate it. Thanks for having me.
All right. Well, thanks for joining us. We will see you right back here tomorrow at 10:30. Your next coronavirus update will come at 3 p.m. East Coast time. Take care out there.